Well, hello, lovelies. This is Missy, the menopause midwife, and today is Tuesday, February 11th, 2025, and I have the honor and pleasure of having Karindy Ong with me today. She is the MyoHacker. A what, you ask? Well, we will get into that shortly and let her explain. But first, I want to tell you a little bit about her. Karindy is a licensed speech language pathologist who graduated from the University of Houston with a Master's of Arts in Communication Sciences and Disorders in 2015. She has extensive clinical experience in acute, post-acute, inpatient, and outpatient rehabilitation hospital settings. Karindy has also specialized in experience working with brain injury disorders of consciousness, spinal cord injuries, infant feeding issues, and orofacial myofunctional disorders, and feeding, swallowing, and orofacial myofunctional disorders in her private practice, which is called MyoHackers LP. Karindy is passionate about myofunctional therapy, feeding issues, the role of fascia, CFT, which is craniosacral fascial therapy, collaborating with a qualified team of providers, and getting to the root causes. She has developed a broad understanding of holistic and functional medicine applications and utilizes an integrative approach in every case. To improve treatment outcomes and reduce treatment time, she uses biofeedback and biohacking technologies also. She is on a mission to educate families near and far so they may change their family tree today. She lives in Katy, Texas with her 2 sons, husband, and rescue puppy Halo. Karindy and I met a few years ago on a biohackers group. She was sharing her expertise with us about myofunctional training, and it was fascinating. It really resonated with me that our bite and tongue position in our mouth impact our gait, posture, and most of all, strength. On a personal note, shortly after I met Karindy, I was in physical therapy for a rib that loves to rotate out of place, which is super uncomfortable if you've ever experienced it. And the PT wanted me to consider getting a special mouth guard because half of my teeth don't touch each other when I bite. I was intrigued, but it was pretty pricey, so I've put that on hold, but I still think it would be helpful, and Karindy will probably convince me today that I need to do that. I mean, though, how can my bite affect my ribs? It's amazing. It just blows my mind. So today we're going to begin to learn how these body systems work together. We will be exploring a fascinating specialty that you might not know much about. I'm still learning. I can hardly say it even. And it could transform the way that you breathe, eat, sleep, and even speak. So we're talking about orofacial myofunctional therapy, and it's a field dedicated to addressing the often overlooked muscles and functions of the face, jaw, and mouth. You might be thinking, why would I need therapy for my face? But consider this. Every time you breathe, chew, swallow, or smile, your orofacial muscles are hard at work. So oro for mouth and facial for our face. When these muscles are out of sync, it can lead to a surprising range of issues, from sleep apnea and TMJ to speech difficulties and even orthodontic challenges. It surprised me to learn that orofacial myofunctional therapy is rooted in practices that date back centuries. In ancient times, oral health and facial function were integral to overall well-being. Fast forward to today, we're now rediscovering the profound connections between the face, body, and even mental health. With a growing focus on holistic approaches to wellness, this field is gaining momentum among those looking to correct functional issues and optimize their health. In this episode, Karindy will teach us about how these techniques can help you unlock better breathing, improved posture, and a healthier jawline, because who doesn't want any of those things? We'll also dive into the surprising link between facial function and sleep, why oral habits like mouth breathing can wreak havoc, and practical steps you can take to bring balance to your face. So if you're ready to uncover the hidden superpowers of your face, join us as we dive into the world of orofacial myofunctional therapy. Your face and your health might just thank you. Hi, I'm Missy Macholka, the menopause midwife. I'm here to break down all the things about menopause and hormones that seem overly complicated, which is pretty much everything. With over 10 years of experience catching babies and 2 decades of intuitive massage therapy practice, I have spent the last few years deep diving into all things menopause to figure out why so many women are suffering and why there seems to be so much confusion about hormones and menopause. Calling on my midwifery experience and my desire to help women attain and maintain full autonomy, I will stay next to you during this life transition and help to explain the options as you step into your power and find optimal health. Well, welcome, Karindy. Thank you for joining us today. It's so great to have you here.
I'm so excited to be here. This is going to be fun.
Yes. So we're going to jump right in because there's a lot to talk about today. And my very first question for you is, what is myofunctional training? It seems like a mouthful, and I think a lot of us are confused, me included.
So I'll say that there are actually two different things. You've got myofunctional therapy, which I'll be talking about. That's what I do. And then you'll hear the term myotraining. And I just wanted to share because that's going to be things like face yoga. It's more of like an anti-wrinkle treatment. That's kind of its own space. So if you've heard of that before, I do like to delineate a little bit. What I do specifically is called myofunctional therapy. And that is going to be retraining the muscles of the face, of the lips, of the mouth, the tongue, all of these muscles that are important for breathing, speaking, chewing, and swallowing. So that is what myofunctional therapy does. My background professionally is as a speech language pathologist, which working in the hospitals, we worked on swallowing. Let's say somebody has a stroke and then they have some weakness. So we would work on that. But I personally didn't know about the field of myofunctional therapy, which has a different specificity and it works on things differently than the traditional approach of dysphagia therapy.
Well, that really helps because, face yoga is kind of having its day. And so
I love face yoga. I wish I did it more because when I do it, I'm like, oh my gosh, my wrinkles are going away. Like it works, guys. It really does. Just be brand specific. Like if you find, I know there are these random ones, like these random Russian knockoffs. Don't do those. They will actually give you more wrinkles. There are some quality ones. If they have a big following, they're probably pretty good.
Oh, good to know. And if you have a favorite one, we'll throw it in the show notes.
My favorite is, I think her name is Fumiko. I think it's just called face yoga. She does a lot of stabilizing the facial muscles and isolating isometrically different ones.
Oh, I didn't even know we were going to talk about that at all. So this is wonderful. More information for everyone. So especially as we age, I feel like it's such a new concept that I'd love for our listeners to become familiar with how our jaw, our face, our muscles affect our bite, our swallow, and our gait and our posture. Because I know as we age, our gait and our posture are really kind of a big deal. And people don't even think about their bite and their swallow as they age, but these things change. Can you talk to us a little bit about that?
Absolutely. So first, let me walk us through kind of what an ideal rest posture is of the airway and the mouth, and then how we should be functioning, because this will then, once you have that understanding, it makes more sense what happens as we age and how we can kind of go into a misshapen use of these structures. So from the time we're in infancy, in utero, our tongue should actually be shaping our cranium. So our tongue should be going up, touching, the tongue tip should be touching the front of your palate, which there's a specific spot as adults behind our two front teeth. It's called the incisive papilla. This should be where that swallow, where our placement engages initially, and then the tongue should be pressing up on the palate. And it's this force, this pressure that gives scaffolding for the palatal formation, which the palate is, just think of it as like the floor of the nose and the foundation for the rest of the cranium. So our cranial bones should be growing and extending from this. So what we should have is a tongue that is able to adequately lift and rest in the palate. If, however, we have tethered oral tissues, or let's say you don't have a tongue tie or some restriction, but maybe as a baby, you catch a cold and so you have to start breathing through your mouth for a little bit and then it becomes a habit. This means that instead of us breathing through our nose and the tongue suctioned up in the palate so it's out of our airway space, what can happen is that we actually start to grow our airway, which the airway is going to include, for our purposes, we'll talk about the nose, the sinuses, the oral cavity. Think about behind the mouth, like behind the tongue. So that pharyngeal space, all of that, it's going to start growing around this pattern of we've shifted out of nasal breathing, which is what we want, and into mouth breathing. If you have a mouth breathing pattern, then your tongue is no longer supporting the cranial bones. It's no longer supporting growth of the palate in this widening way. And instead, we're getting the force, that suction force of our swallow, which is going to be driven by the tongue, the cheeks, and then we have these muscles in the back of our throat or the back of our mouth that are providing this vacuum force, and that swallow force is going to drive those bones to go up high and narrow. So I'm going to say then, fast forward, you may have compensated as a child and then as a young adult, and you were okay. You were able to kind of muscle your way through, not sleeping great, doing different things. Like you felt fatigue. Maybe you had inflammation growing up, lots of tonsil and adenoid issues. Maybe they were even removed. Maybe they had to pull some teeth because your mouth was crowded, or you had braces and they shifted things. And again, you can be kind of okay. And then we get hormonal shifts. And this is where we start to see issues in the connective tissue, the collagen, and the muscle mass. So we start to get into sarcopenia. And even if it's just subtle, if we have just a little bit of a muscle mass reduction, all of a sudden we've lost some of that vertical height of our airway space. We get collapsing in the back. And so somebody who didn't have snoring issues at all before suddenly does. And their spouse or their partner is waking them up and saying, "You've been snoring. You've been snoring." And so then this often is a reason why women will come and see me. They'll report that they suddenly are having TMJ issues and they never had a history of it, but they don't know what's going on. So what I can see often, I won't say in every case, but often I'll see in their mouth signs and symptoms of dysfunction, but because they had enough muscle mass, they were able to kind of, like I said, push through it and they were okay. But as that starts to thin and weaken, we start to get more of this compensation where people are resting their teeth together, they're clenching, and the joint is popping out, especially as we get that collagen reduction.
And I didn't even think about the connection between perimenopause and menopause and the sarcopenia that we do experience and our mouth. I just didn't even make the connection. So that's even more reason for ladies to make sure that you stay on top of your hormones as we move into
Absolutely.
this
I mean,
stage.
I would say that's a huge part. And when I was working in a clinic and working for someone else, I wasn't able to necessarily say these things, but now I say whatever I want. So I tell people, like, if women come and see me, and I'm not currently accepting new patients, but when I was, I would tell them, if you're a woman really over the age of 30, and we could even argue younger than that, but I only hold this line hard for over the age of 30, I want them getting their hormones checked before they come and see me, because I'm going to make that referral anyway. So it might take a while to get that panel run, but thyroid and hormones are so integral and important, especially if we have signs and symptoms of POTS or dizziness, anything like that. I want to make sure, okay, where are we at with that? Because we want to address those concerns before we really dive in to what we're going to do from a muscle exercise standpoint with myofunctional therapy.
Wow. My mind continues to get blown. So when you say there's a spot for your tongue to hit the roof of your mouth, so my question is, like, you can touch the back of your teeth with your tip of your tongue, but then there's like kind of that first ridge. Does your tongue touch the back of your teeth and only the tip, or does your whole tongue ideally suction to the top of your mouth in resting?
So ideally, your whole tongue should be up in your hard palate. Where
Okay.
we have kind of that cutoff space is around the soft palate. And it's different for everyone structurally, but that is ideally where it should be. So if you have a history of a tongue tie, then what is likely, and we have different types of tongue ties. And so I won't get into all the classifications, but just for thinking about it, you can have what's considered an anterior tongue tie, or a tongue tie where there's frenulum or fascia that is tightly held from the tip of the tongue to the mandible in the front of the tongue, which that's often identified in a hospital. Like people will see, or even, midwives will see that and they'll be like, "Oh, this is a tongue tie." And so they identify that. That's going to be that tongue that if you try and stick it out of your mouth, makes a heart shape, or it can't go very far. That tends to be spotted. The ones that are less identified are going to be the posterior tongue ties. So those are going to be where the frenum is pretty tight or it's thick, more around halfway. Well, again, I won't get into exactly where it is because it's going to be different on each tongue, but basically it's restricting the range of motion of the tongue in the back. So
Oh,
we're not able to get the tongue to adequately rest in the palate, which when we don't have that, it's likely that we have a higher vaulted palate.
well, and then it also, I mean, that makes me think about when kids have an expander in their mouth
Mhm.
for braces, and then you learn to not bring your tongue to the top of your mouth because you physically can't when you have that expander in, and it's usually 6 months or so that you have that in your mouth.
So that is, you know, there you can have sort of that negative side effect of it during that time. However, in general, the reason people are doing it is because if your palate is really narrow and high, you're not gonna be able to get your tongue up there anyways.
Oh,
And
okay.
so often, like before a tongue tie release, it's very common that we recommend getting an expander or doing that process, whichever type of appliance or tool you use, will recommend doing that process prior to the release because otherwise you're not going to get that satisfaction and relief of the tongue being able to rest in the palate. If you get a tongue tie release and your palate is still really high and narrow, and your tongue still can't really fit there, it doesn't mean that it's not beneficial. I have a patient who this week, her palate is high and narrow. She got a tongue tie release and her shoulder pain has finally gone away. And she's, feeling so much better. And she's in perimenopause, she's done mineral balancing and other things. And so she has taken to it really well. But she was like, I just want to see if I can get this tension to go. So even though it's not the full suction, it's made a difference enough that now as she sleeps at night, instead of her tongue dropping back into the back of her throat and causing an apneic episode, she's actually okay. She's sleeping better and her tongue is staying suctioned through that glue of saliva and the suction force.
Wow. And so when you say she had a release, is that something physical that you
Yes.
do with her?
I do not.
Okay.
So a
No.
release is going to be a surgical procedure done by an ENT, an oral surgeon, or typically the patients I work with, it's going to be a dentist. And so they get a laser release. Some people use other tools, but generally nowadays it's done through a laser. And they will actually address that tension point of the frenum. And this is where it's very beneficial to do the work prior to the release. If you don't do a myofunctional treatment plan prior, then that tissue can be kind of hard for the surgeon to clearly and specifically identify what is muscle, what is mucosal covering versus what is fascia. And so when you do the work of myofunctional therapy, which is helping to distinguish that tone, like it clarifies which tissues are which, it makes it so much easier for them, but it also makes that fascia just kind of pop. So the laser is just barely there. That's why we call it a release. It's releasing from those tight points. And all of a sudden we have that muscle that is able to move.
That's incredible. So you work with people before, during, and then after
Yes.
a surgical release.
Yes. Yes.
Okay.
And not
Okay.
everyone needs a release. I do want to
Uh-huh.
clarify that. Sometimes we have adapted in such a way to get through life that we're not getting our tongue up. And so we have these tension patterns. We're holding ourselves tighter. And sometimes that's all it is. We just need to have some retraining on how to move the muscles and how to rest with our tongue up in our palate so that our jaw can take a break. Because otherwise, that's where you have your rest posture, might be that your teeth are together and you're clenching, and that's how you're resting.
Okay. Well, I have a couple of questions, and maybe you can take it whatever direction you think would be best next. One is like maybe your top three favorite habits or tricks that you could share with people today. But then also, I think that you have a program that you're coming out with. So I'd love to hear about that kind of in conjunction with what maybe people can start with and see if it's something they need or want.
Absolutely. So, what I would say for the tips and tricks, what I love is actually telling people to eat whole apples. Like, this really makes a big difference with the skin on. A lot of people will
Oh.
slice them
Hmm.
or they'll peel them. And so, you want to get it organic, but please eat whole apples. We are not eating food anymore that is whole, that is rough, and that requires that pressure and that contact through the joint, through the teeth. So it's very important that we do this, especially, people will think about it for development purposes in children, but we need it as we age, because if we are not getting that bone on bone contact that we get through chewing of hard foods, then what will happen is we actually start to get a reduction. We don't get those osteoblasts sort of telling us, grow, you should reinforce this. You actually reduce that. So we need to prioritize that even more as we are aging. So that would
So
be
it's like
one.
weightlifting for your
Mhm.
teeth or
It's
for your jaw.
yeah, and we have 20,000 sensory receptors in each tooth. So it's also neurologically very important that we keep that contact, that input to our brain. It's very important for that. It helps with lymphatic drainage. So, we store fluid in our gums, we're aware of tonsils and adenoids, but in the oral cavity, we have lymph. We have it throughout our whole body. And as we think, we're going to be aware that we move lymph through walking, through, the big six, whatever it is, we're going to do those things to move that lymphatic fluid. We also do it through chewing. So I want people to be doing that. It's very important. And just keeping that, and maybe you can't do a whole apple, but something else. I just want you getting contact through the teeth. And notice, are you chewing on one side predominantly versus the other? And it can be, it was even, and then you had a dental surgery or a procedure and you had to swap sides. Were you able to then move out of it? Are you able to go evenly back to the teeth? And it might be that your occlusion, that your teeth are not hitting evenly, and that's more of an issue that you need to take a look at. So that's going to be one. The second tip is going to be about the tip. So I want you to rest the tip of your tongue to the spot behind your two front teeth. So that is, yeah. So just ha ha ha. I like to have people make a sound with it because it's weird if you just do
So
this and
even
like
if you're
stare at
in your
someone.
car, make the sound with us, put your
I mean,
tongue on the
yeah,
back of your teeth
exactly.
and ha ha ha. Okay,
Yeah,
that's
when
cool.
you
That
do
makes
that, and so as you're resting with your tongue behind your two front teeth on that spot, you don't have to be making that sound. I just have people do it initially because they feel the tone in the sides of the tongue. And then my second tip is I want people to practice clicking. And then that is usually how we lead into a tongue suction hold. So if I tell somebody, lift the back of your tongue and hold it to your palate, who has done that ever? Like, that sounds really weird. So what I usually do is I tell people, click, bring the back of your tongue up. And if you can't do it just on your own, what you can do is actually press your finger down on your tongue and you push down on your tongue, and then you practice mentally just lifting your tongue against that resistance. And so you're going to push down and you're lifting your tongue up. That actually helps reinforce, okay, this is what that elevation should feel like. Then practice the clicks. That is going to be a great way to work on some of that muscle tone and to help you practice getting your tongue up. Now, if you find you're doing that and it's still not making a difference, this is when you go and you find a myofunctional therapist and get an evaluation.
That's awesome. Because I feel like there's so much that can be done at home with this. I'm wondering if is your program for all kinds
So
of people?
it is. So I created the program MyoMagic at Home. It is an online course really to support practicing all of these drills. So we will do drills and sessions, and it's really, you want to get these repetitions in. And it came about really for multiple reasons. I had patients that were like, can you just give us videos to help us with these exercises at home? And we would record videos during our sessions, but they kind of wanted something a little just easier to access than pulling out their phone and doing all this stuff. So from that standpoint, that's where I initially created it. And then I started to see that like there was a lot that people could access without the full evaluation, which I always want. I had people reaching out. They wanted to know like what could they do? They were in kind of remote places and I was trying to find them different therapists that were local. So then I started opening up more access to this. Anyways, it is a course really for families to be able to facilitate exercises at home while they're kind of waiting to get into myofunctional therapy. I always want to clarify, it doesn't take the place of it. It's an augment for it. But I have had now multiple parents parents that have gone through it, because they're doing it with their kiddos. And so even though it is designed for 15 or 16 years old and really even younger, when we get to teenagers, you've got to be kind of cool to get their buy-in. So, it's going to be just kind of that 4 and up. I see toddlers go through it all the time with their siblings and they benefit. And then I see parents go through it and they benefit. It starts to change the quality of their sleep. So I'm actually in the middle of changing it for all these reasons because I found, it's having wider applications than I originally intended. So it is something people can sign up for right now, but just know that in March, it's going through a change. And so that they should be seeing that soon. But it really is something that equips people with how they can start doing these exercises to help them with quality of sleep. I do just make this caveat. If you're an adult and you're doing these exercises, please know that you're not going to be able to do the same range of motion as kids right away. Doesn't mean you won't get there, but you want to be mindful, especially if you have any TMJ pain, history of trigeminal neuralgia, migraines, things like this, that if you do have tension at midline in your tongue, that you might exacerbate it initially as you do these exercises. So for adults, I recommend a little bit of a slower warm up to doing them, and that really you don't do more than like 2 or 3 exercise sets, like different types of exercises per session.
Okay. Well, that's all I can think of is the family that clicks together sleeps well.
Yes, absolutely. You're right.
Something like that. I am not the advertising PR person, but it's just so sweet to me when a family can be involved in something and it's good for everybody in the household.
Absolutely. And the modeling, because I am
Mhm.
very, specific with parents. I'll be like, they're watching your mouth all the time.
Yeah.
So I have kids. Kids love this. I tell them to be the mouth breathing police. And I'm like, it's your job to keep an eye out and watch. Are people breathing through their noses or are they breathing through their mouths? And they love it. And then parents all of a sudden are aware. They're like, oh,
Mhm.
I've been breathing through my mouth.
Yes. And that maybe brings me to one of my rapid fire questions, but it doesn't have to be rapid fire because I feel
Mhm.
like maybe you have a little something to say about this is mouth taping at night
Mhm.
to make sure that you're not mouth breathing. That's something I've introduced into my life a couple of years ago. And now I don't sleep very well without it. And I notice my tongue, it can fall down even with the mouth tape, but I do try to be conscious of bringing it up when I'm aware of it. What are your thoughts on mouth taping?
So I'm a huge fan of mouth tape, and I do not think it's for everyone. So that is the important takeaway. And there are
Mhm.
reasons. If you put mouth tape on, so for one thing, I tell people to try it during the day at first. Do not put it on and then try and lay down. Your body's not going to love that. Some people push through it, but in general, if you hate it, you may have done it in that way. So you want to get your nervous system used to that proprioceptively.
Mhm.
And you also want to give your body a chance to regulate and go, oh, I can actually breathe, even though this is here. So I
Mhm.
love for people to have that chance. And then let's say you put it on and you do that and you warm up, but you're like, I cannot sleep. It might be that you have to open your mouth because when you do, all of a sudden it gives you a little bit more distance that your tongue, it's kind of going forward and out of your airway. Or it can be that your tongue is pushing through your teeth or through the sides. And that is how you're getting a little bit more space. It's coming out of your airway that way. So it might be that mouth tape suddenly takes away your ability to get your tongue out of your airway space. When that's the case, it's not going to help you to mouth tape, at least at first. As we work on tone and we start changing, because when we improve the tone of the tongue, it actually can change its size. Like it changes how it's engaging in your mouth. And so what needed more space before suddenly doesn't. I don't promise that for everyone, but it is absolutely an outcome that we see with myofunctional therapy. So I would say if you have tried it, you're like, that was terrible, then I definitely would say talk to your dentist if they're an airway focused dentist, or talk to a myofunctional therapist. And a great place, a great resource, guys, if you're trying to figure out how to find these people, is the Airway Circle directory. I'm not affiliated with them, but I refer to it all the time. And it doesn't have every provider in the world, but a lot of people have signed up for that directory. So if you're like, I want to find somebody now, I do recommend you go and check that out.
Oh, that's great. Thank you for that tip.
Mhm.
And I really appreciate what you say about mouth tape because it is just like anything, there's just not one way to do anything. So, and that is a
Or one
wonderful
mouth tape for everyone. I have
right.
multiple types, and sometimes I'm like, "No, we need kinesio tape. We're not gonna even do that."
Yeah, it
Yeah.
took me about 5 different tapes to find one that I really like, and I
Which one do you
finally
like?
found oh, now you're gonna ask me, I'm gonna have to run downstairs
Well,
and
just
get it.
describe it. Just
I'll
yeah.
link it. So it looks like kinesio tape, and it's a rectangle, and it goes all the way around my mouth because the ones that go on your lips, if you put chapstick on or
I know.
anything,
Yeah, yeah.
it comes right off. So when I put it on, I kinda hold my hand over it, like, around my chin and my upper lip to kinda warm it up. I always tell people, "Don't just yank it off in the morning, like, just kinda peel it gently so you're not, like, ripping your skin off."
Yes. Same
And
with
I can use
Breathe Right strips, if you
oh,
use those
yeah.
on your nose. Those are fabulous for helping with nasal breathing. They don't, like, fix it completely, but they help quite a bit. But if you yank them off, you'll have this bright red spot on the middle of your nose.
Yeah, yeah, so be gentle with yourselves out there. Okay, so we are pushing up against time, so I
Mhm.
do if you're okay with it, I wanna do a couple of rapid fires.
Do it.
Okay, and I think you've already kind of answered this, but this is something everybody's gonna ask is, can you help our husbands stop snoring?
Absolutely. Yes, absolutely. Most of the time, men take a little bit more buy in to get them to do this because they just drop their mouth open and then they feel like they're fine. But I mean, the risk for cardiac issues, for stroke, all of these issues are very, very much increased when we have sleep disrupted or sleep disordered breathing. So please tell them, like, this is for their brain health, for their heart health, for longevity. You want them to have quality of life and you want them to be here. So a sleep study can be very beneficial. Get them started on that. If they're like, no, I won't do any of that, you might be able to get their buy in with the Replenish nozzle. However, it takes work. Like they have to swallow on this straw and it can be kind of tight in the back. So they might not do it, but that's if they won't do anything else. You might be able to get them to have more tone in the back depending on the type of snore they have.
And there's, like, the mouth things that people are talking about right now. I've seen them that, like, help push your tongue maybe into the right position. What are your thoughts about those things? I
Which
don't even know what
things?
they're called.
The Spot Pal?
Oh, maybe that's it. Can you talk to
So
us about any
that's a
that
different
you like?
one. Or or are you talking about the sleep thing that's the suction that pulls your tongue out of your mouth?
No, I don't
Okay.
even know what
Okay.
that is.
So oh my gosh, that's a Joe Rogan thing. But anyways,
Okay.
lots of people the Spot Pal, it's basically like a mini retainer of sorts. Retainer is the wrong word, but it gives a little cue of where the spot is. So you just place your tongue to that spot because you feel this input, this
Okay.
grooving. Think of it like a mini mouth guard that gives you a little bit of a signal of where your tongue should be. So that's a great option. You just send them scans or they'll send you a mold and then it'll give you that. I'm a
Okay.
fan.
All right. That's great. Okay, chewing gum. Good, bad, indifferent?
So I chew gum. Does that mean it's good? I don't chew it all the time and I use it meaningfully. So what that means is sometimes I'll use it for, a variety of purposes with patients to help them with specifically lateralization. Where we see the problem is you start to lose focus. You're no longer attending to how you're chewing the gum. And then you're going to kind of find wherever that place is and you might just stay there and you're chewing. And if you're not shifting sides, then you're going to start bulking up the masseter one side. So here's the thing. You can use chewing gum, be intentional about it. And once you notice that you're no longer paying attention, please spit it out.
Okay, great tip. Okay, this is totally random and you may not have an answer for me, but since you work with the mouth, bad breath, and kind of connecting with that, amino breath. So we're all trying to get our protein up. And a
Yeah.
lot of us are taking amino acids. I am one of those people. And my kids are like, Mama, amino breath. And so I don't know if there's anything, if you know anything about that. I mean, I'm like nasal breathing for sure to make sure, keeping gum around for sure. But is there
Mhm.
any way to mitigate any of that from
You
your
know,
experience?
I don't actually know about amino breath specific. Like I haven't. It's funny because I have patients with that, and we haven't specifically talked about addressing it from that angle. So I will get back to you on that because I don't want to
Okay.
give you just like a cursory, like, oh, that you could do this. However, it is usually related to pH. So if you can improve the pH balance of your mouth after that amino breath, that can make a huge difference. So like Bliss probiotics, there are so many different probiotics you can now get that improve the flora in the mouth. That can make a huge difference, as well as nitric oxide. So it can be that you deplete that a little bit to utilize the aminos, which we know, because when we have higher proteins, all these things, it does shift the pH of our body. So just being mindful of the pH. Where are we? And you can test that. You can test your pH with pH strips and see if after taking your aminos, I'd be curious, are you seeing that there's been a shift one way or the other? And then change your balance based on whether it's baking soda or whatever it is, using that as your measure.
That is a great idea. I love it. And so before we leave, is there any way you'd like people to get a hold of you for your new course or a way they can sign up before it's released?
Sure. So I'm not sure when this is going to air, but right now they can actually sign up for my course as it is. It's pretty funny. I recorded it like between soccer. My kids would like run to soccer. So you can tell. But I have now seen so many lives changed from it. The content is good, but I'm going to improve the quality of it. So you can sign up for it now as it is, and then you'll be able to just sign up later for the brand new version. If you're in it now, you'll be grandfathered into the better version, in my opinion. So I would say don't wait. Just go ahead and join. And then if people want to connect with me, they can find me at MyoHacker SLP. And that's on Instagram. They can find me. I'm on Facebook, and then the MyoHacker podcast. That's where weekly I dive into airway concerns, holistic concerns, because it's all related, all of it. So gait, swallowing, all of it.
That's awesome. Thank you, Karindy. It's so great to have you here. And I do have, if you have one more minute, I have one more quick question for you. If you were stuck on a deserted island, what 3 to 5 supplements would you have with you?
Ooh, can I do a combo supplement?
Sure.
So I would take Date. I would want my vitamin D, A, K, and E. And then I would take omega-3s. Then, depending on where that island is, probably some activated charcoal in case I get some giardia, some nasty stuff to swap it up.
All right. That's great. Yeah, I think charcoal is essential no matter where you are, right? 'Cause you just never know what you're going to run into.
Yeah, on the
Oh,
tropical
well,
island, some rotten coconut, gotta help with it.
Karindy, it's been wonderful having you here. Thank you so much for being with us today.
Thank you so much for having me. It's been fun.
Thank you for joining me here today on The Menopause Midwife. If you'd like more information or to work with me, feel free to check out my website and book a wellness consultation at ohm406.com. Be well.